Thank you for attending our webinar. Just to make people aware, we are recording the meeting, and obviously that will help us in terms of capturing comments and suggestions. And we know that we have some people that are unable to attend, so we'll make the recording available on our website after the meeting. Just some housekeeping. If you could keep your microphones off when if you're not speaking, and we have a raise hand function, and also you can write comments in our chat box as well if you wish to ask a question. So this is a webinar around pregnancy, and my name is Dan Abiziarko. I'm sort of chairing today, along with my colleague Jane Piggott, who's a midwife, and Dr. Sunita Chakrabarti. In a few moments, they'll be providing a presentation just to kind of give an overview around some maybe unanswered questions around pregnancy and vaccination. And then we have already had some questions that have been sent in from the public. So we will take some time to answer those, but obviously you've got the ability to ask questions either through the chat or at the end when we'll be opening it up to questions. And then we'll finish at 8:30. So just a couple of little comments before I hand over to my colleagues Jane and Sunita. If people have got questions sort of outside of the webinar, we do have an email address where they can contact us, which is the blmk.ccg.communications@nhs.net. On our CCG website, we also have a page that's dedicated to pregnancy and vaccinations, and there's quite a bit of detailed information. There's a video from local midwives talking about the vaccination, and you'll also find some of the latest guidance from the Royal College of Obstetrics and Gynecologists on there as well. And I know that Jim will be talking about vaccinations, but in terms of where to go to get vaccinated, we have a list of drop-in sites available on our website at that link, www.blmk.ccg.nhs.uk/drop-in, and that site has all of the latest locations that are available across BLMK, enabling people to drop in to get vaccinated. It includes large vaccination sites and pharmacies. We update it each Monday with the details of the latest locations, and the great thing about those sites is that there is no need to book, just as long as you can turn up at the times that it's open. I would suggest not turning up 5 minutes before they close, but if you just turn up at any of those sites, there's no need to book an appointment. You won't need to show any ID. You won't even need to have an NHS number, and the team there will be happy to support and sort you out. So that's my sort of blurb and introductions. I'm going to hand over to Jane and to Sunita. They've got a series of slides. Don't worry if there's a lot of information on the slides, I appreciate that, but don't worry, I'm sure that they will talk through them and we will make the information available once the presentation is over.
Thanks, Dan, that's great. So the points Dan's just highlighted on that website is really key for us, because it's your go-to resource for you to know about the vaccination in pregnancy. So it's a really good slide there. I'm Jane, public health midwife for the BLMK, and I work alongside Sunita Chakrabarti.
Hello, everybody. Really glad to meet you all today. My name is Sunita Chakrabarti, and I'm a women's health doctor and a public health doctor working across Bedfordshire, Luton, Milton Keynes. We're also joined today by one of our obstetricians, Maria Moyes, who will also be with us and helping to take some questions as well. Really looking forward to having a good conversation around the importance of COVID vaccination in pregnancy.
Yeah, so Sunita and I could talk about this for a long time on our own, so it'd be brilliant if people can get involved and ask us some questions. We really want to know what it is that's causing people concern or a hesitancy about getting the vaccine, and what information you want to know. So please do pass your comments in the chat box. We've got somebody monitoring that for us to get those questions brought forward so we can answer them. But Dan, if we can go to the next slide, I think it's just an overview of what we're going to go through. So yeah, as Dan said, we've got quite a lot of content on the slides, but it means that if you do come back to watch us afterwards, you can have another look at the content. We're going to go through viruses and how that encapsulates the coronavirus and the COVID-19, then about how COVID-19 or coronavirus, as it's referred to, is affecting pregnancy and newborns, then about the vaccine, and then a bit about vaccine and pregnancy and how we've got to where we are today. And then at the end of that, there's some links again, the valuable resources that we refer you to that are reliable and evidence-based resources that can help you make that choice about having the vaccine. So we can have the next slide, Dan, that'd be great. Anita, do you want me to carry on and we're gonna go together? Cool.
Absolutely,
So,
Jane, please carry on. Yes.
So as you're probably aware, viruses are smaller than bacteria, and viruses can't replicate. So therefore, they have to find a host to replicate on, and that's why you'll see that viruses can transmit through the population. And we've had the incidence of COVID-19, which is linked to coronavirus. So it's a respiratory virus that's around in animals and humans, and it's commonly passed through airborne transmission, so from droplets in the nose or from the mouth, and it can also survive on surfaces. This isn't anything new that we already know about, but it's just to give you a little bit of history as to where we are. And pregnancy puts women at greater risk of COVID-19 and the complications that it comes with. So you're not more likely to get COVID because you're pregnant, but your immune system is compromised when you're pregnant, therefore that does put you at greater risk to some degree. But you are more at risk of the complications. So you can become more seriously unwell from COVID compared to your non-pregnant counterpart of the same age. So therefore, this is why we want to make it very aware to you as what situation you're in, being a pregnant person, and the benefits of having the vaccine and being aware of the risks associated. So we can have the next slide, Dan. I'm not gonna, and then so what do we know? We know that, as I said before, pregnant women are not at any greater risk of catching COVID-19 than any other healthy adults, but they are more at risk of the severe complications. And alongside that, if pregnant women have any comorbidities, then that can put them at greater risk as well, alongside the normal population, a non-pregnant counterpart in the population. A small proportion of women can experience serious complications and can be admitted to intensive care. And in that instance, this is where you can then lead to a preterm delivery, or you may need ventilation and you'll be in intensive care and need more support. So it's just making you aware that though you're not more likely to get COVID because you're pregnant, it's the complications around it, and you're more at risk of getting these complications in the 3rd trimester. And that's why it's paramount that if you are going to have the vaccine, you get it as soon as you can in your pregnancy, or follow the vaccination program to make sure you're fully vaccinated by that 3rd trimester, because that's when you're most at risk from the complications. As we said before, it increases your risk of preterm birth by 2 to 3 times. Women that come in with symptomatic COVID, and neonates born to mothers who are positive to COVID have an increased risk to the neonatal units. They're going to need some assistance as well. Can you just go on to the next slide, Dan? Because I'm just not too sure if the next one just tells me something else that I want to say. So it doesn't, we're going to highlight it quickly. So at the moment, with this wave of COVID, we are seeing more pregnant women admitted symptomatic with COVID, and they're very unwell. In the first wave, we saw pregnant women being admitted with no symptoms, but were found to be COVID positive. So they were coping quite well. But with the changes in variants, we're seeing that pregnant women are more susceptible to the risks, and they're more susceptible to the virus. So that's why the vaccination has become so paramount for pregnant women, to ensure that you're safe during your pregnancy. So vaccines are created in an ideal to produce the same protection that you would get from the natural infection, and it's to prevent the severity of the infections, your complications from it. It's not to stop you from getting COVID, it is just to limit the effects that you're going to get, or try to limit the effects that you may potentially get from the vaccine. Vaccines have to go through a vigorous safety procedure to be tested. They have to go through a number of phases, and they're tested. Manufacturers have to prove that they are safe, and then actually that there's a benefit for people to have a vaccine over not having a vaccine, and that the side effects of the vaccine outweigh the risks of not having it. So it's very regulated, it's monitored all the time, and it's not just monitored up until the point of where the vaccine is licensed, it's monitored after that as well. So as I said, you get 3 different phases, and Dan, if I could have the next slide, just to highlight with the COVID vaccine, these 3 phases were still carried out with the COVID vaccine, but they were just they would just run in parallel, so it fed up, it made it quick. The testing process was done quicker than it would have done had the phases been done after each other. They were all run alongside each other, testing certain populations, testing seeing how the dosages between vaccines, and gave the best outcomes, to making sure that what the recommendations were the correct and the evidence-based.
And Jane, can I just add on there that I think there is anxiety in our mums thinking in December or whenever we started the vaccination program, we were being cautious, and we were saying, if you're pregnant, take advice from your midwife and then go for the vaccination. What we've since learned is in pregnancy, this vaccine is safe. Now, we are always cautious about our expectant and pregnant moms whenever we bring on a new medication or a new drug or a new vaccine, because we want to be absolutely sure that it's not going to affect the unborn baby and the pregnant mom in such a delicate position. But what we know for sure now is that the vaccine is very safe in pregnancy. In the very millions that we've vaccinated, there's several thousands and thousands of pregnant women, and they've gone on to have successful pregnancies, and they've been protected in pregnancy from getting severe disease from COVID. But as Jane was highlighting, where we've seen moms become ill from COVID and they've not been vaccinated, we are seeing that now in hospital as well. Many of them are suffering quite acutely, which can be prevented if you have the vaccine.
Yeah, and it's the biggest point, I think, Sunita, that we hear, isn't it? Is that people thought the vaccine was unsafe and has now just magically changed to being safe, and that's not the case. It was just that it wasn't recommended because we didn't have the evidence around it to ensure that it was safe in pregnancy, and we do, because we've now vaccinated a number of women in England, thousands and thousands of women in England without adverse outcomes, and so is America. So we know that the vaccine is safe. We know that there's certain concerns that are going around with the social media or even amongst friends and discussing it. I've got friends that are trying to get pregnant, are pregnant, and they ask me questions about the vaccine. So it spans everybody, and with everyone being concerned about the vaccine. But what we really want you to do is take the evidence, the reliable evidence and details, not the things that you see kind of spread on social media, but reliable websites. The RCOG, like Dan mentioned earlier on, has a great decision aid tool, and we've got the link at the end of this, that helps you read through where the vaccine's got to today in pregnancy, and it helps you probably discuss it with your partner or your family to actually come to a decision yourself as to whether you want to have the vaccine or not. And it is a very individual decision. We're not sitting here preaching to you saying go and get it, you've got to have it. It's recommended, so yes, we would encourage you to get it, but it is still your decision, and you need to read that data around and the information around it. And then if you've got any questions, if you've got any certain scenarios, please contact us. We literally are responding to queries all the time about the vaccine. We are at the end of the telephone, we're at the end of an email. We are here to answer questions, so please direct them through to us, and we want to help you as much as possible to make you feel more confident in making this decision. So and
your midwife will be able to give you a lot of more advice, particularly if you've got concerns in your pregnancy. Then your midwife or your consultant will be able to give you more advice. I think, Jane, if you don't have any more slides, let's just take some of the questions from colleagues or mums who've joined. Is there anything more?
Is there one more? I don't know.
Yeah,
is there
I
one
think
more
there's
slide
one more. Yes, yeah.
I made these. Oh, we can skip on from that. Oh, just to highlight though, obviously about the vaccine. So initially there's AstraZeneca, there's Pfizer, and there's Moderna. And obviously there was some queries around or concerns around clotting problems with the AstraZeneca vaccine. And that was isolated to a very rare type of blood clot on the brain, and it's linked to low platelets. And in pregnancy, we normally test you with your bloods, and we know situations where some of these things might have occurred. So therefore, if you have been made aware that you've got an issue, then obviously AstraZeneca would cause concern. But if you've had AstraZeneca previously, before you're pregnant or when you didn't know you're pregnant, the second dose of AstraZeneca is fine if you haven't had any adverse outcomes. But if you're starting your vaccination regime as a pregnant person, we now recommend Pfizer or Moderna as a gold standard. But if you've had AstraZeneca before, don't feel like you're in any disadvantage. It's still effective, and you've obviously had it in it, and you've been safe with it. You're safe to go on to have your second dose of that vaccine. So it's not to be too alarmed about. But again, any questions, ask your midwife, ask your GP, ask your consultant, because probably someone that's got issues will be being led with a consultant. Can I have the next slide, Dan? I think that then just leaves us on to the fact that the bits that we've covered, that the vaccination is recommended, it's safe in pregnancy and for breastfeeding, there's no known risks for either, and that we encourage you to go and source that vaccine. When we first started this, when the guidance changed around pregnancy, we had to do an awful lot about referring women over for the vaccine. It's really easy for you to get your vaccine now. You can go to Dan's website and have a look at the drop-in clinics. You can just turn up, and if you make yourself known to somebody, someone that works there, they can then fast track you as a pregnant person, so you don't have to sit around and wait. And we are also looking at bringing the vaccination to the hospital. So when you're in your antenatal clinics, we're bringing it to you to even make it more accessible for you, and that should happen in the next few weeks, so please keep an eye out for that. And the biggest thing from us is that the 2 doses are very important to have before the 3rd trimester. But if you can't do that, then that's fine. Just get your next vaccine as soon as you can, but still within your pregnancy. Don't think, oh, I've had one and I'll wait until I've delivered. Just follow the normal vaccination regime. Yes, you may get some side effects. So you may have an achy arm, you may feel a little bit unwell. In that case, rest is advisable. Rest up, let it kind of do its thing, and it does that to everybody. So it's not specific just to pregnancy. Some people suffer side effects and some people don't. And then just take normal precautions that you would do. Paracetamol is safe in pregnancy, so if you need something to help you get through those, if it is bad, then you can take some paracetamol, but please don't take ibuprofen. And yeah, get your vaccine, and hopefully then obviously you're then protected in that postnatal period when you're busy with your little newborn as well. So that's great. But yeah, we'll take some questions. I think we're done with those slides, aren't we, Dan? I think it's the links that we've just got up there for you to read. That we'd really direct you to have a look at, because they are really good resources of all of the information. There's leaflets in different languages. There's all types of advice on there. Hearing from midwives. There's hearing from other health professionals. There's a lot of information on there that's really helpful. So questions wise, do we have any questions at all, or do we go to the ones we've already had submitted?
Do you want to start with the ones that you've had already while people are going to put their hands up?
I think someone's just raised their hand actually. Dan, should we go to there?
Yes, we can. So Steph, I can see you've raised your hand. If you want to go ahead with your question.
Hi, yeah, can you hear me?
Yes, we can hear you.
Yeah, so I had my first dose of Pfizer back towards the end of May. Had booked in for my second. I subsequently found out that I was expecting. I'm currently now 14 weeks. I did actually cancel the second dose just because I was just really unsure whether it was safe. You know, the first 12 weeks, they would say, are key for the development of the baby. So my question is, if I do decide to now have that second dose, have I left it too late, effectively?
Don't know if anybody else wants to answer this, or you're happy for me to go ahead?
Can I jump in?
Go for it, Marie.
Hi, Steph. You haven't left it too late. I mean, we know that the trials were based on dosing the 2 vaccines apart 4, some 8, and then 12 weeks. So the antibodies are still present for up to 6 months. So you'll still provide yourself with the booster. And in terms of risk versus benefit, because you're after the first trimester, it will be great for you to actually have the vaccine now to protect yourself for the rest of the pregnancy, especially as we're going into winter. And with the new variants around, it's much better to be protected than leave it to chance.
Yeah.
Okay.
I think we've got this big thing about timeframes, haven't we? And I think in one way we're saying to have the vaccine in a certain time frame, and then it worries you if you haven't met that time frame. But you are encouraged and you're safe to still go ahead with that. So yeah. Does that answer your question, Steph? Are you happy with that?
It does. Yeah.
And you're certainly not the only one. We've had many people ask that question. So I think it's a really good question to ask, because a lot of people have got that concern. So yeah, that's great. Thank you.
Okay, thank you.
Anybody else got any questions they want to ask us?
There's no others at the moment. You had a question via email, didn't you?
Yep. Shall I read it out?
Yeah, sure.
Go. So before I got pregnant, I had my first AstraZeneca jab. Since then, the clotting problems came to light and I was no longer recommended for under 40s or pregnant. I am under 40 and now pregnant. The official NHS guidance is that if you had the first AstraZeneca without any issues, then you can have the second, even when pregnant and under 40. And I've tried to research the safety of AstraZeneca during pregnancy, but all the studies and research in pregnancy is for the other jabs, as very few pregnant women are offered AstraZeneca. I'm therefore reluctant to have the second jab without more evidence of its safety. I've discussed the possibility of getting a different jab, but mixing jabs is not yet possible during pregnancy. Last time I checked the figures, the number of hospitalised pregnant women who have been given one jab was only 5, which doesn't seem significant and doesn't encourage me to risk getting the second AstraZeneca. Is there any more information you can give me to help my situation?
Do you want to go for it, Jane?
Are you going? You want me to,
yeah, you go for it, and then we can,
so,
Maria and I can just add add any more additional information. Maria, is that all right?
Yeah, no problem.
So the JCVI does recommend that you carry on with the same vaccine as this lady has mentioned to make sure that you complete your vaccination programme. As I mentioned in the slides, the risks to AstraZeneca are restricted or are linked to a certain type of blood clots and certain predisposed risk factors. And if you had one dose, you would have had that response on that first dose. Therefore, you are safe to have the second one. The mixing of it is not advisable because there's no evidence around that. Therefore, you'd be technically trialing yourself. And that's more of an unknown than what it is on the fact of the AstraZeneca. So therefore, we would encourage you to have the AstraZeneca. The only evidence that we've got or data around it, because we haven't got anybody that's mixed the vaccines, would be that the AstraZeneca is safe if you've already had the first vaccine and you haven't had any adverse outcomes. And when we say adverse outcomes, it's not just the side effects that everybody kind of non-pregnant is suffering from. It's you've been hospitalised and you've actually been diagnosed as having an adverse outcome to the vaccine. Does anybody else want to add anything else to that?
Yeah, just to add, Jane, so in terms of the mixing of the vaccines, they have started doing some studies in the non-pregnant population, and that's why it's quite difficult to extrapolate it to pregnant women because that evidence is not there. But what they have found in non-pregnant people is that you mount a good immune response despite the mixing of the vaccination as well. So if AZ was first and Pfizer was second, there will still be an increased immune response of antibodies to the vaccine, which is what we would expect. There's no reason why that wouldn't happen in pregnancy, but we just don't have the evidence really for that. And that's why I think the recommendation is to try stick to the same vaccine, which you know you haven't reacted to originally.
Need to add anything else onto that? So you're nodding away.
No, I think Maria has clarified it, and I absolutely understand. We absolutely understand the anxiety and the concern that you probably have because the guidance changed following some of that. But what you need to understand is those risk of blood clots happen after the first vaccine. So all of those cases were kind of then. Second, after that, if people were okay after the first vaccine, the subsequent vaccine didn't seem to produce the blood clots. And what I say to women, I mean, pregnancy is not going to preclude you to have more clots or anything like that. So you know, it's all, but as Maria said, the advantage of having the vaccine and not having COVID because of that, or not having serious COVID because of that, probably gives you more benefit, because COVID itself causes significant blood clots, and that causes quite serious problems for us and for our patients. So it's just to understand the risk and benefit balance and go with what you feel is the best for you. But the advice is, if you've had the first vaccine with AstraZeneca, to just have the second vaccine as well.
Jane,
yeah.
We've got a question in the chat. I don't know if you can see that. It's
No, I can probably find it. Can get it up.
It's a
Hold on.
question from Sam. I can read it out.
Okay, so I want to ask if there is likely to be any changes to the visiting after birth or having a birth partner at the Luton Dunstable Hospital due to COVID restrictions. As I understand, partners are only allowed to visit for 2 hours each day, and you are only allowed one birth partner at present. So, not technically a vaccination question, but I don't know the answer to that. Actually, that is down to our heads of midwifery. They follow the guidance that is the national guidance around that, and it's weighing up the risks to other patients and the benefits of you, but more the risk of other people coming onto the ward. So I wouldn't want to comment on what the potential is for that. I know they're looking at it all the time, and if they can make the changes, of course they will. But at the same time, we're fully aware that recently we have got an increase in COVID positive patients locally. We've got an increase in of COVID positive mums locally. So therefore, we have to limit that risk as to spreading that virus around. So I'm pretty sure as soon as they are able to, and I will go back and I'll ask the questions after this and see if I can get you something of an update on that. But I'm pretty sure as soon as they can, they will be moving on the visiting elements to it as much as they can. Sunita, do you want to add anything to that?
No, and I think what we are trying all the time, striving, is to keep our mums safe. And as safe as we can, because as Jane said, what we know for sure is that the significant transmissibility, which is the spread of the current variants, and we're seeing them in our pregnant mums. So as I said, as Jane said, Maria, you can come in on this as well because you're an obstetrician at the L&D. I think we keep reviewing our infection control guidance, and we take significant, we take it really seriously because we absolutely understand the importance of having partners during the birth, but it is just about, again, then balancing the risk because we're seeing so many of our pregnant mums coming in so sick. Maria, did you want to add anything more from the L&D perspective?
Yeah, just to say we have a high number of pregnant ladies being admitted with COVID currently, really unwell, and a lot of the time the partners are infected also. So there are a lot of considerations being given to the visiting times and who can come in for support and stuff. So in the short term, it is likely to stay limited as to what the current guidelines are, because the numbers are just going up. So it's exactly what you've said. It's weighing up the risks and benefits for the whole population group who's admitted on labour ward or wherever they are, antenatal ward or postnatal ward. And sorry, Sunita, I just got to clarify, I'm a physician, not an obstetrician.
We count you as a physician anyway, obstetrician anyway. Yes, probably tongue twister for me, an obstetric physician. But nonetheless, Maria spends a lot of time looking after some of our very sick moms with COVID. So that's why Maria is here today to emphasize on the message about the vaccination, because why and how we think it's so important to protect our pregnant mums.
I think, Steph, do you want to come in on this conversation? You've got a separate question. Please feel free just to speak if you want to add into this conversation. Anyway.
You might be on mute, Steph.
Oh, good point, Dan.
Oh yeah, sorry. Sorry.
It's okay.
Sorry.
Trying to here at home as well.
Oh, bless.
Sorry, I have got a couple of questions. I just really thanks for this, because I've been waiting for something like this for ages, just to get a few concerns and hear a bit more that's actually proper information, rather than like what you say on social media and things, because there is a lot of going on. But just two quick things really, which is obviously the fact that I've got that delay from the first dose, because obviously my intention was to have the 2 doses, straight up, but obviously the pregnancy, then I felt unsure about it. I do have a slight concern with it was the Pfizer one that I had, because I'm under 40, hearing about the heart issues that have seemed to have occurred. Now I have read that it tends to affect younger males, but it is a bit of a concern because it happened usually on the 2nd dose. Now, obviously, that's the dose I would be having. So I have got a slight concern regarding that, taking it, albeit it's a small risk, I understand. And secondly, it's the fear, I guess, or the unknown is, would there be any long-term effect on the baby? I know there's nothing that they know of at the moment, but I'm talking like sort of development-wise.
Great question. I'm going to bounce this to Sunita because she's nodded on Maria, because they're not.
No, it's okay.
To say it.
Maria, jump in.
Thanks. You're welcome to add in as well. So just to answer your question about the impact on the baby, actually there's been a study recently published, and I can't remember which European country it was, but they've showed that when the mom's body forms antibodies against the COVID virus, some of those antibodies are transferred to the baby. So when they tested the baby's blood after birth, they found COVID antibodies. So it actually protects the baby as well. And there's been no reports anywhere saying that the vaccine actually harms the baby in any, terms of development or anything like that. Of course, we don't have any long-term data, but if we think about other vaccines given in pregnancy, there are no issues in the short term and the long term as far as we know. The other thing to consider is that if someone who's pregnant had to get COVID in pregnancy, and I say this from experience as well, active COVID causes preterm birth, it causes premature labor, and having a baby at 25 weeks or 30 weeks is then going to cause bigger problems, because there will be massive developmental issues and lots of complications, and that's if the baby survives being born so young. So it's about weighing it up and seeing what resonates with you and what sits comfortably with you. So the risk of having COVID and being aware of those big risks, which we're aware of, or the risk of the vaccine, of which the side effects might include the myocarditis, and there's no ways to predict, if anyone would get that or not, versus the protection that we've seen, which can affect the baby without causing any, structural problems or anything like that.
Does that answer your question, Steph? I just do want some clarity around that.
Yeah, thank you. Obviously,
Sure.
it is still because obviously long term we don't know, no one knows, and that's what vaccines are all about. Years ago, if no one took a vaccine, we wouldn't be where we are now. I think it's
and if you look at some of the so because in theory with this you have to some of the side effects that are reported, if you were to look at other medications or other situations, those things might have been reported anyway, but they're just then linked to the vaccine, but actually aren't actually a cause and effect relationship. They just kind of happen at the same time, but might have happened anyway. So sometimes we need to take that into consideration as well, that though you've had the vaccine, you can't then say that this caused X, Y, and Z, because potentially that could have been something that had developed or you had previously. But a lot of people are kind of trying to link the two, and that causes more confusion, I think, at the same time. So totally get it. It's hard to make that decision, but as we said before, it's getting the information and weighing it up and making your own choice that's really, really important. And it is something you want to discuss with your family and your partner and other people, as long as obviously those inputs are beneficial and not kind of totally one-sided or influencing, so to speak. Just on the back of that, because I know we've mentioned vaccines, and just while I'm going to get the plug in just now whilst we're here, all vaccinations in pregnancy are really important. It's not just COVID. We have our whooping cough or pertussis vaccine, as it's also known, which is very important, and that is around protecting the baby when it's born from whooping cough. And we've also got coming up the flu vaccine. And obviously with the current situation, we are considering that there may potentially be a quite big flu pandemic, or not pandemic, but flu outbreak this year, because of the previous years of us being in lockdown and bits and pieces. So with that unknown, I'd encourage everyone to go and get their flu vaccine as soon as it's available to you in pregnancy, and we're currently waiting upon that stock to come in of the flu vaccine, and then to go and get that one as well. So and on another point, just to cover, this isn't going to go on to link to the questions, but I'm just going to make another point. If you are COVID positive and you are isolating, please speak to your midwife. Don't just think you're isolated and you can't speak to somebody. Ring your midwife and let them know that you are isolating, or and that if you can't make appointments, because there are other things that we can do. You haven't got to sit at home and think I'm isolated and I can't access any care. You can, and we can help you via other means. So please just speak to your midwife, and if you can't speak to your midwife, there is other telephone numbers. You can speak to your local maternity department for advice, and the same things still are still important. Watching your baby's fetal movements, making sure you're getting your exercise and keeping healthy, hydrated, all those types of things are still majorly important. It's not all about COVID. It is important for us to make sure you're healthy in pregnancy as well. Have we got any more questions, Dan, or should I go back to my list of the previous ones?
If you can go back to your list, because we haven't got any in the chat.
That's fine. So we might have answered this, I don't know, but let me just read it. Do you believe there is a risk to the baby if the woman has already had the first jab prior to getting pregnant and then waiting after the 12-week period to then get a second jab? I think Steph's answered, Steph's question was brilliant and has actually captured that, because that you've gone with the gap in between. So I think we've answered that one. Sunita, do you think we've answered that one? Yeah, cool, that's fine.
I think that's yeah, that's answered. If there's any further questions or clarifications required, very happy to go back over it again.
Yeah, and the third question that we had that came in on our link beforehand was about risk to unborn, heard about stillbirth, and I think we'll go back to what Maria just said, in the fact that you're looking at preterm deliveries or you're looking at premature babies and the risks associated around that. So every obviously scenario has different ways of playing it out. So you just need to make sure that when you're thinking about it, you look at all scenarios, not just one specific one. But certainly the vaccine is not linked to increase in stillbirths or cause in stillbirths. I've got no evidence based on that. Actually, by having the vaccine, you're going to reduce the risk of you potentially having a preterm delivery and complications from COVID that may link to a stillbirth. COVID has, let me have a look. Have you looked at the yellow card data? Yes, that's what I mentioned earlier on. We've got the yellow card data is where people report their adverse side effects from COVID, but they literally list everything as it might be as a side effects. Therefore, not many of those things that are reported are actually a cause and effect relationship with the vaccine that has created their side effect. It could be something else. So yes, the yellow card data is there for you to read on the internet. It's quite it does make some good reading to give you some backup information around the vaccine and the ifs, buts, maybes, and anything in between. So have a read of that, and it does give you quite a good resource and knowledge. Other than that,
James,
I haven't got any other questions, Dan. Yeah,
I've got a question in the chat from Nuala.
I get excited about these. Yeah. Oh, do you want me to read it? Sorry, I'll go back to it. I can see it. Let me have it. I had COVID in June at 34 weeks pregnant. My baby is now 9 weeks old and I am exclusively breastfeeding. Unsure as to whether I should have the vaccine now, or if the natural immunity I have hopefully built up from having COVID would provide enough protection to allow me to reach 6 months, or exclusively breastfeeding before having the vaccine then. Okay, let me just digest that question. My baby is now 9 weeks old and I'm unsure as to whether I should have the vaccine now, or if the natural immunity I have.
I can answer, Jane.
Go for it.
But
Go on, Maria.
jump in. So it's difficult to answer that, Sarah, because There's still studies looking at how long the natural immunity of COVID lasts. So it's predicted to be around, we don't know, they're saying about 9 months, but there's no hard evidence confirming that. So if you wanted to wait until 6 months because you had COVID already, you would in theory still have antibodies to protect you until that point. When I had COVID, the guideline at that time was to have a vaccination within 3 months after having it. But at that stage, nobody knew. I'm not sure we still know. So in theory, you should be fine.
Can I just jump in on that then? So I think if the guidance hasn't changed much, is that ideally you can take your vaccine 28 days after after you've recovered from COVID. And as Maria said, the evidence is still being developed or around immunity from the natural immunity from COVID infection. So we are not sure. But what we know as well is that many people, even if they've had the COVID vaccine, are getting infected a second time. Some it might not be as serious, but there is cases that that people are getting infected a second time. It's because that we've got different variants, and we just don't know whether we've got immunity against some of them. And also you kind of mentioned around the your breastfeeding, and you want to take the vaccine, but you kind of want to hold on. I think what Jane mentioned before is that the vaccination is safe in breastfeeding. And I think Maria also mentioned that the vaccine as such is not in any way going to cause any other harm or damage to baby. Certainly not if you're breastfeeding. So those are some of the things to consider, and your personal circumstances, and then make the choice that you want to do. But congratulations, you've had a lovely baby, and really good to hear that you were 34 weeks and you had COVID, and you've gone on to have a healthy pregnancy and a healthy baby, which is really, really good news, isn't it, Maria? Because so many a times we see some of our mums really struggling when they get COVID at that late stage in pregnancy.
Yeah, indeed. I mean, the last 2 weeks have just been crazy, with some moms even landing up on ITU. It's actually been very overwhelming. So, yeah, we've got to make sensible decisions.
And on that note, we can still also do the social distancing, wear your masks, wash your hands, hand sanitize, all those things still come into play, regardless of the vaccine. You should still be doing all of that. Even if you've had the vaccine, it doesn't stop you from getting COVID. It just limits or potentially limits your effects of it. So masks, hand washing, space, ventilate your rooms and things like that. All that guidance still applies. Any other questions? Oh, I can hear something clicking off there. We've got more questions in the chat, Dan.
There's another question from Laura.
Cool. What would you still recommend the vaccine if someone is in the latter weeks of pregnancy, i.e. 32 weeks or over? A lot of the associated risks of COVID you mentioned were around preterm birth, which becomes less of a risk as pregnancy progresses. I'm going to go back to my main screen. Anybody wants to answer that, or we're going to sing together and go, yes, your vaccine is still important at any stage of your pregnancy, and ideally, yes, later on in pregnancy, as you get further on in your gestation, it's the less risk of a preterm delivery, but you still don't know how your baby is going to fare when it comes out. So therefore, I would encourage, the recommendation is to get the vaccine in pregnancy to prevent your risks of COVID. And obviously that is linked to a preterm delivery, and the risks associated around a preterm delivery aren't guaranteed by a certain gestation. So definitely get your vaccine. You obviously won't get your 2 doses in, but 1 is better than none. And then you can follow up with that postnatally when you are actually then postnatal and trying to care for a newborn. You'll then be covered as well.
And can
Anybody
I,
else want to add anything?
I want to bring Maria in. Maria, of course, in your practice, you've been seeing many of our mums in that late stage in pregnancy being infected with COVID, really struggling and ending up in ITU. It might be good for you to give some sort of information to Laura to kind of just make that decision, isn't it? Because you know, we are all at risk of COVID because COVID is circulating amongst us. It's this huge you know, prevalence burden of COVID virus in the community, which we know is spreading widely. So the chances are that we will possibly get infected if we don't have antibody. But Maria, did you want to jump in on the kind of late pregnancy and COVID and the risks?
Yeah. So I'll just clarify. So preterm is delivery less than 37 weeks. So, and that's because of you know, lung maturity for the baby. It only really, the lungs only really fully mature around 36, 37 weeks. So that's one consideration. The other thing to think about is even if you later in the pregnancy, you've still got to get to 40 weeks ideally before delivering. So there's still that 4-week gap where there's an increased risk to getting COVID. And in the unvaccinated, it's severe COVID, to be honest. There's also a risk of developing stillbirth with active disease, and that's a big concern. So there have been stories, and we've seen it, of unfortunately moms losing their babies because of being really sick with COVID. And recently we had a lady admitted to ITU. She's intubated and the baby's in NICU. And to be honest, we don't know if either of them are going to survive. And I'm not saying it as a scary story. It's just the reality of what's happening at the moment because of the fear around vaccination and women not having the right information to make a decision about vaccination. So I'd have to agree with what the panel have said. Even if you're 34 weeks or 36 weeks or 37 weeks, then it's still important to get the vaccine to prevent the other risk factors, such as you know, stillbirth or developing respiratory complications around the time of delivery and then needing maybe an emergency C-section or something like that. So there are other complications that need to be weighed up as well.
I hope that answers the question there, Laura. I think it's quite clear in what we're kind of. Oh, brilliant. I've got the PC on here. I can see that pop up saying thank you. That's great. Does anybody else have any questions? Please, we take your advantage of us while we're here because it's perfect time. We've got Maria too, so it's perfect time for you to ask any questions or anything that you think might be relevant for the people. And everyone who asks the question, normally somebody else is thinking it, so it's quite good for someone to ask one. I'm trying to think, Sunita, of what our common questions are that we've heard in from our women, and mine for me is around the 2 doses. If you've had AstraZeneca previously, should you have it for a second dose? And I think we've covered that. Yes, you should. And the other point is when I talk to pregnant women is about the fact that it was unsafe and now safe, and what's changed, because they can't see that anything's changed. And as I highlighted initially, it wasn't that anything's changed. The vaccine wasn't unsafe. It was just never. We were unaware of whether it was or wasn't, but now we've got the data that backs that up. And it's good that we do, considering this Delta variant is causing more complications in pregnant women. So at least we've got that now to support the vaccination in pregnancy, which is good. If anyone got any other questions that might not be related to the vaccine specifically, but COVID, or who's got a hand? I can't see that. Who is it? Sarah.
Hi.
That's it. Hello.
My question was sort of not around the vaccine, but when I had my first midwife appointment and I spoke about the vaccine, the midwife actually told me she'd had a couple of ladies who had gone to have their vaccine and they'd actually been turned away from having it because they weren't 12 weeks plus.
Yeah.
So that was a bit of a shock to me, and I then decided not to have mine until 12 weeks plus. And I reported it to my doctor, who said that she'd never heard of that, and that obviously wasn't supposed to be the case, and she was going to take it to one of her clinical trials. So it was just to say that possibly maybe that's also what's happening in some places.
Yeah.
But I'd never heard of it before.
Yeah, no, see, I did see some guidance around that when we first had the vaccine in pregnancy, but I think with COVID, we're kind of, a lot of the advice that's come out has come out quite quickly, and sometimes we were playing catch up with some of the current guidance, and and the public were aware of it as much as we were as healthcare professionals. So sometimes that message has to filter through, and it gets a little bit like Chinese whisper sometimes. It's not passed on directly, or they haven't read the same resources and documentation. Unfortunately, that's where the communication chain breaks down, and we are trying to spread the word of the update. And I think Public Health England are very much, and NHS England are much better in getting a lot of resources out there now for people to use, and the current guidance is very much in the news a lot of the times. Therefore, what you see on the news with regards to ages around the vaccine or who's going to be vaccinated has been correct. There was some query around 12 weeks. Initially, I think it said the guidance was around 12 weeks, and then it did change to say it was safe in pregnancy. Flu vaccine is given at any stage in pregnancy, and it's built on the same form as the COVID one. So that's how they know that that is safe, and it doesn't cause any effects on the developing fetus. But Nita, did you want to add anything else?
Yeah, so Sarah,
changed so quickly.
Yeah, so Sarah, you're absolutely right, because you know, around pregnancy, some of the evidence is developing at a rapid speed, and as you can see every day on the news, why do we get so much information at such a speed? That's another question I get asked a lot. As in, doctor, we didn't have a vaccine like 10 months ago, and now you're kind of saying everybody needs the vaccine and that's protecting us. It's because all of us scientists have dropped everything that they're ever doing, and this is the prime research. 12 weeks ideally is considered as one of those kind of first trimesters where the baby is developing, and we try and tell mums, healthy mums, if there is any possibility to kind of avoid any sort of medication that that you're starting off, or anything that you can postpone, and so 12 weeks we kind of give that general advice, and I think that's where some of that messaging had come from. And as Jane said, some of our guidance wasn't absolutely very clear, particularly around the trimesters. But most recently, the Royal College of Obstetricians and Gynecologists, who are the experts, have deliberated and made some very clear guidance that the vaccine can be taken anytime in pregnancy. So I'm really sorry to hear about your friends and colleagues and the advice that the midwife gave, which may have been right at the time because we were not quite sure. And I think the guidance wasn't giving us that kind of evidence, but now more so clearly, we are absolutely sure, because the Royal College of Obstetricians and Gynecology most recently have updated their guidance to say that the vaccine can be taken at any gestation in pregnancy, because what we've started to see, as Maria is saying, because she works in our ITU with some of our very sick children, sick mums, is that it's better to have the vaccine, and that might protect you from getting very serious illness. So I think that's the case. Maria wants to jump in. I was going to get her in anyway. Over to you, Maria.
Thanks, Anita. Actually, I'm going to just digress slightly, if I may. I think I understand, like, it's a difficult decision to make. When you're pregnant, you want to do the right thing, and I just want to reassure moms that there's no right or wrong. You just got to do what you're comfortable with. But when making the decision, I would really encourage looking at, number one, what are the risk factors for COVID, and that's the same as in the non-pregnant population. So if anyone suffers from high blood pressure, diabetes, is overweight, is of an ethnic minority group, those are risk factors for COVID and becoming significantly ill. The other thing to consider is then the impacts, and maybe looking at the research sites that have been posted and to look at some of the statistics. So, for example, if a woman has COVID, she has 8 in 1,000 chance of having a stillbirth baby, whereas the side effect of getting, say, myocarditis or inflammation of the heart from one of the vaccines is 4, I think it's 4 people per million cases. So it's like a 0.004, even less than that percent chance. So when thinking about it, it's all relative, and I would really encourage you all to look at what is the higher risk in terms of having or not having the vaccine. Thanks, Anita. That's all I wanted to say.
Yes, and that's great, isn't it, Maria? Because I think the media doesn't help, because the media is always kind of highlighting some of the side effects, and the number game around this epidemic around this pandemic has been immense. It's can be quite overwhelming and confusing, particularly if you're not living, breathing it like some of us. So you're absolutely right that the relative risk of actually having any of the side effects from the vaccine is pretty low. And some of them are, some of them have come about when we've actually looked at some of the case studies. We still need to do some more. Is in people who probably had some underlying condition anyway. What we know for sure is our pregnant moms, in majority, are healthy, young people. Pregnancy is a normal physiological reaction. It's something that's kind of is just fine, with no inherent complications of anything. So the vaccine should ideally be safe, because we've vaccinated moms for many years. But I think, to emphasize that point, Maria, thank you so much for that. That the risks, or even with the myocarditis or even the blood clots, are very tiny, one or several in 1 million, whereas the risk of having the complications from COVID are far higher. And it's important to understand those numbers and those relative risks. I think there's something came in on the chat.
It's Maria. She just put something on the chat saying COVID doesn't prevent getting COVID, but it prevents severe COVID, which is the concern, the big concern.
Oh, sorry, the vaccine.
I think you meant it COVID vaccine.
Yeah.
Yes. COVID vaccine, sorry.
Yes, that's okay, doesn't matter.
We got what you meant, it's fine.
I can see that Sarah still has a hand up. I don't know whether she's happy with the answer, or whether she wanted to. Oh, she's put her hand down. Okay.
Oh yeah, sorry. No, I really appreciate that. I was just going to say very quickly, I was the lady that asked that question on your first submission about the risk to the baby having had my first vaccine already. Do you think that's put me in a good position that I've had my first one prior to getting pregnant, and then it's not too much of a concern having my second one?
Yeah, so I was waiting to see whether we can see them move, see if they're going to come off mute. Yeah, ideally you're in a great position because you've had one dose and you haven't had any reactions to it, and then you need to get your second dose to make sure you're fully covered following the vaccination programme. Whether that's better to somebody else, I can't pass comment to that as to what other people do, but yeah, go and get your second one and get yourself fully vaccinated.
Yeah.
Would be my best bit of advice to you.
Thank you.
Flying around in my room.
Because
yeah, I appreciate that.
the 2 doses gives you the full protection and gives you the maximum level of antibodies. So yes, you've probably got partial immunity because you've already had a first dose, but the second dose will give you that full whack of immunity, particularly to then kind of little bit rest assured in your pregnancy that you're protected against severe COVID infection, even if you come across it.
Okay, fantastic. Thank you very much.
I'm just conscious of the time, and I think
we've had too much fun, haven't we? Look, it's 8:30 before we know it.
If there's no more questions, can I just thank Jane, Sunita and Maria for providing the presentation and also answering some of the questions from the audience as well. Clearly, as Jane has said, around kind of, you know, we're urging people to kind of get information, and that's what this webinar will do, to provide people with information around whether they should make that decision around getting the vaccine. So I really appreciate you giving up your time in support of this and enabling women to make an informed choice before they get the vaccine.
Well, to be honest, Dan, we really appreciate women coming in and listening as well, because we're trying to get the message out there, and it's kind of one of those things that we can only do so much. This is brilliant that you've engaged and want to know the answers and ask your questions and want to have more information to make that choice. So that's really good from our point of view as well. So thank you.
Yeah, and please talk to other pregnant mums and ask them to come forward with their questions like you have today, because the more questions we can get answered, we're fighting a significant battle against social media, isn't it, Dan? Dan is our social media and communication expert, and strives amazingly hard to counteract some of the myths that are going around the vaccination. And it's almost like it feels like a battle sometimes, isn't it, Dan? Because you answer some questions and then there's other questions that come up. So please talk to other pregnant mums. Please talk to women who are anticipating, you know, or trying to get pregnant or are planning pregnancy. If they've got questions, if they can't come to a webinar like this, to go to our website to get all the information, and not use just social media to get your advice and information. And the other thing is, talk to your midwives. The midwives will give you the right information. And even if they don't know the latest guidance, they'll probably be able to signpost you to get the information. And if today we've been able to change your mind, then you know where our drop-in sessions are. There'll be one running tomorrow. There'll be some over the weekend. You know where to go and get your vaccine. So if you've been convinced by some of the answers we've given you today, please go get your vaccine. So those were the 3 messages from me.
That's fantastic. Thank you very much, Jane, Sunita and Maria. Thank you for our audience for the questions as well. It's you know, we can always obviously present, but it makes it for a very interactive and interesting session if we get questions from the audience as well. So thank you for your time. We are going to make the recording available. We're going to edit it so to make sure that people's names, etc., if it can't be seen. But like I say, we'll just go through that. We're not going to tailor the answers, but we just want to make sure that it's from a privacy point of view, just to make sure that the people's information isn't seen, and then we'll make it available on our website. So thank you very much.
Can I just come in? There's a comment from Glyn, Laura's partner. Thank you, Glyn. We want to engage more with partners and expectant dads as well, because you know it's a joint anxiety if you have questions. So thank you, Glyn, for joining. And please, can you also talk to your friends who are also expectant dads, because they might have questions too, which is absolutely fine to ask. It's important that we know what your questions, and then let us know. And we're very happy to engage, you know, and expectant dads as well. So please, Glyn, take this opportunity, and thank you for joining our webinar today.
That email address is open to everybody, so that's not just pregnancy, it's for any vaccine query or any BLMK query for us. But yeah, email it through to there if you've got any questions and we can respond to them. Oh, thanks as well, Dan.
That's all right. Thank you very much. Take care.
A big thank you to Liz and Dan for helping us put this webinar together, and hope to talk to you more soon. But do keep in touch and keep talking to us. Thank you very much.
Thank you.